Greetings from Fast Track. Today I want to try and help calm down anxiety regarding the current pandemic. The fact is, anxiety affects 40 million people in the United States. Keep in mind there's only 331 million people in the United States. So anxiety, even pre-coronavirus, is a big problem. Now when you put coronavirus on top of it, you've got a significant part of the population that is very anxious about this disorder. So I want to talk about a few things to hopefully help calm the situation down. Keep in mind, I'm not encouraging you to go out and do crazy things. I'm just telling you, as precautions lift and as you get back into society, I want you to keep this stuff in mind so it helps to calm your situation down. Now, first thing I want to do is tell you a personal story. When I first got out of college, I went to work in the hospital. Now, I can tell you I had no intention of working in a hospital setting, so I avoided the clinical rotations in the hospital. I only wanted to do outpatient physical therapy where I was working with bones and spines and necks. I didn't want to do any of that acute stuff. But getting out of school, there were no jobs available, so I had to go work in the hospital. When I started working in the hospital, I'll tell you the truth, I was scared. AIDS was a big thing at the time, and I thought, oh my God, how do I deal with working with these patients? I'm scared. I did not want to get infected. And what I learned over 7 years of working in this setting is, you know what? As long as you do the right thing, you're at little to no risk. Think about how many healthcare providers you know that have died from an infectious disease. It's very, very low. Most doctors, nurses, therapists, we all retire from the healthcare setting perfectly fine. We did not get any of these bad bugs. And believe me, it's not just AIDS in the hospital. You're working with tuberculosis. You're working with tons of different bad funguses, bacteria, viruses. They're all there. And what you learn is infection control beats in your head in the hospital. Don't worry about much of anything as long as you adhere to standard precautions. Standard precautions are simply that you treat everyone the same, and you know that as long as you avoid blood and body fluids and you keep your hands out of your face, you're pretty much fine. When there is an airborne thing, then you do need to wear a mask or face shield, depending on what the situation is. But after years of working in that setting, I became very, very comfortable and no longer feared working with these patients. And so everything was fine. So I would tell you that just know at first you will probably feel some anxiety going out and getting in amongst populations again. But remember, the coronavirus is not airborne. At least to this date, they don't believe it's spread just through the air. So it has to be spread from one person to another person. They don't believe that it can travel more than 6 feet. That's the point of the social distancing, maintaining a 6-foot distance. So beyond that, the thing does not have wings, it cannot fly. That is the only transmission vehicle is from person to person. Also, keep in mind, our integumentary system or our skin is phenomenal at protecting us. As long as there is no nick or cut or anything in your skin, it's definitely not going in that way. With the coronavirus, the main transmission line is mouth, nose, eyes. So keep your hands out of your face. I have significant concerns about the mask. Now, while the masks do help me from spreading it to you, if I was infected, if I do have a mask on, it helps my saliva when I'm talking not to be transmitted. The problem is, let's say I don't have the coronavirus and I somehow come into contact with something and I do it on my hands. Because you do have to remember, if I was, say, infected with the coronavirus and I touch something, it can be still sitting on an object. So now I touch it and I get the coronavirus on my hand. Now these masks frequently cause you to be adjusting, especially I've got facial hair. I got facial hair stuck in my mouth, it's up my nose, it's itching, it's irritating. I tend to want to grab my face. Now I can tell you, working in the hospital, I never touched my face. I didn't shove anything in my mouth except food at lunchtime. But nothing really went around my face because I know this is an easy access target for things. So you are taught and just beat on, don't put stuff in your face. That mask causes you to want to touch things. Even when you say take it off, you get to a safe place, you think, okay, I'm fine. If you don't wash your hands before you take that mask off, you might do something that gets a little bit somewhere where you don't want it, and then it goes inside of you. So I would encourage you, if you are wearing a mask, make sure you wash your hands before you touch that mask to take it off, and do make sure that you try as best you can not to touch it. And again, I'm as guilty as anybody. I can't keep my hands off the dumb mask. So that is kind of a danger of the masks, that it could cause an increased rate of infection if you're not careful. So, as long as you're washing your hands, that keeps stuff from your hands, which then if they do go on your face, no sweat because you just killed it all. And as long as you maintain your social distancing, the stuff, it's not going to just jump out and get you. So there is total truth, and you can feel very confident in washing your hands regularly. That will really help you out, and avoid contact with your face. That's the big route for infection, and as long as you do that, you should be perfectly safe. So I hope this helps reduce your anxiety as you start to get back into life, and I hope this improves your quality. Thanks.